So one of the most common questions that we get asked is, what is the recovery like after spinal surgery? Most common spine surgery done is in the lumbar spine, which is discectomy or decompression. There can be addition of instrumentation with screws and rods if fusion is intended. Even in these cases, the patient is usually able to get back on their feet the same day or the next day, able to sit, stand and walk. As extensive surgery as scoliosis can also stand on the next day or the very same day depending on their pain level. The suture removal usually happens about 2 weeks from the day of surgery, and at this point of time the patient is able to do minimal activities and get back to their baseline of daily activities. Returning back to work, this can take place between 2 to 4 weeks or as high as 3 months depending on what work it is and what is the level of pain that patient is still having. Light work like desk job can resume their activities in about 2 weeks, but heavy work like lifting objects or labor work can take about 3 months to get back to their work or their baseline. Next is bony fusion. The bony fusion happens between 6 to 12 months if fusion is intended and if screws and rods are inserted. So all in all, this is how the recovery happens after spine surgery. So to conclude, you should be able to get back to your work in about 2 to 4 weeks on an average.